Dalıyorum.
Öyle mi?
Olsun.
Peki. Yes, rhinoplasty nose jobs. One of the most common operations in the world, especially in the past times, in the last, except 5 years, it's one of the most common, number one, because why? The center point of our face is consisting of our nose. The most protruding organ of our body is nose. The most common broken bone of our body is nose and nose and nose. So patients, when they look at the mirror, they see their faces and the eyes, and between the eyes they see their noses. Before the operation of the nose job, we have to remind you that nose is not a hole and it has some functions. First of all, it's a feeling of smell, and you have to get a good air from your nose to your lungs, a healthy air. And the healthy air consists of warmed, humidified and infiltrated air. And the nose function for these three things is very important, especially during the nose job operation. We try to give the functions if they are injured. For example, if you have a septal deviation, the septum is a wall which separates the right and the nose holes between, and this wall can be deviated to one side or the both sides. We take some cartilage tissue out to make the wall straightened again to prevent the air blockage, and we keep these cartilage tissues during the operation to make some spatial grafts to the other sides of the operation. In my hands, this operation takes 1.5 hours, sometimes 2 hours, under general anesthesia. I use general anesthesia for that. It's more comfortable for me and for my patient. There are two techniques for the nose jobs. There are the open technique and the closed technique. The only difference with these techniques are the incision line will be on the columellar side or not. The internal incisions are nearly the same. Especially for the patients who I will work over the tip area, I prefer the open technique. When I raise the skin from the underlying cartilage and bony tissues, I see the skeleton of the nose, and I rust the nose like the carpenter rusts. There are small rusts we have, and we create a neodorsum. We make some stitches to raise the tip, to define the tip, to elevate the tip, to rotate the tip, or to unrotate the tip, and we use some cartilage tissues that we take from the septoplasty operation, and we create a new skeleton of the nose. And at the end of the operation, if we open the roof of the nose with this, our rust, we make an osteotomy, and patients are asking me to break the nose. Yes, sometimes I break this. This is the osteotomy that we try to close the dorsum of the nose, the roof of the nose, by this maneuver. And at the end of the operation, we close the skin, we put some silicone tubes. Nowadays, it's very comfortable tubes that you can take breath from your nose immediately after the operation, and you put a plaster over your dorsum of your nose. You stay in the hospital for the first night, elevating your health, tilted up, and putting ice packs over your eyes every hour, and change the bleeding cottons over your tip. And we give you fluid, we give you antibiotic, we will give you painkillers, and you will be comfortable in the first day. At the second and the third day, or the third day, you come back to my office. I take out the silicone tubes away, and I will teach you how to care about your inside part of your nose. At the end of the 6th or the 7th day, we will take out our plaster out, and you will see a nose in the mirror. During this time, at the second or the third day, there will be an edema and bruising over your eyes especially. This is too normal, and it will increase the amount of this bruising at the first 3 days, and it will decrease suddenly until 7th day. But there will be a little bit edema and bruising, maybe sometimes at the 7th day. When you look at your nose at the end of the taking out the plaster, you will see that it's not a normal nose. It's really bumped. It's edematous, and it's a big nose. Yes, it's normal, because we have to have some time to see the final result. For example, If everything goes alright, after the second week, nobody will understand you who will saw you in her or his life the first time, will understand you if everything goes alright. But it's hard for you to get used to your new face for the fourth month. So you have to be patient, and after the operation there are two magic words you will hear from us: the patience, and massage. You have to pass this time. When you reach to the 6th month of the operation, yes, you will see the final, maybe the near final results, but it will take nearly 1 year to get the final results. So I warn all my patients to be ready for this period. You have to pass this time, because it's not a we do not have a magic stick in our hands to change your noses. You have to pass this time. Why it's important? It's important because sometimes patients are asking me to correct some small deformities before the 1 year, or patients who are being operated anywhere else are coming to me, for example, at the 7th month of the operation to correct a small deformity. To try to correct these deformities before the time that you have to pass before the 1 year cannot be beneficial. Sometimes they can be a little bit dangerous for your health of your nose, so please be ready for that time. Aklıma bunlar geldi. Başka?
Evet.
Yeter mi? Kapatabiliriz.